Okay, in this video, I'd like to talk through dry needling for the forearm and specifically for the flexor compartment of the forearm. So if we look here, this is going to be the medial forearm or towards the ulna. This is the radial side towards the radius. So this anterior medial compartment, these are going to be my wrist flexor group, emanating off of the medial epicondyle of the humerus and traveling distally. So first muscle I want to talk about needling is this Pronator Teres. So this is a cross section that's more towards the elbow, so it's more proximal on the forearm. As the cross section travels more distally, this Pronator Teres is going to approach its attachment on the radius. But if we're more proximal, we can think about needling the Pronator Teres in a direction back towards its attachment at the medial epicondyle, so we can direct towards the ulna actually, or towards the medial attachment, just making sure that we're staying away from that medial antecubital or the antecubital fossa where the median nerve, brachial artery are going to live. So we want to locate that antecubital fossa and we want to make sure we're distal to that. So we can needle Pronator Teres back towards its insertion. If we're more distal, we can angle and needle towards the radius. That is appropriate as well. The other thing that we can think about is our needling direction for the flexor carpi radialis. And in this cross section, because we are so proximal, FCR is living right in here. But as it approaches its attachment, it's going to come more towards the radius. So we can think about needling that muscle. And I'm going to try to get just this little bit back more towards the radius. It's going to be superficial though. Pronator teres, flexor carpi radialis, and palmaris longus, flexor carpi ulnaris. Those muscles are the superficial group, and so we are not thinking about inserting very deep with our needle. FCR, we're going to needle back towards the radius. Same thing is true for flexor digitorum superficialis. And again, this is a very proximal cross section, but if we think about the FDS as being a really broad muscle in that second layer underneath the superficial layer flexors, as we get more distal, it's going to live in this general area. And so FDS, we're going to needle a little bit more distal to where I am. So I apologize for that. It's hard to get everything in one shot or one section. But I'm going to think about needling in roughly this trajectory to pick up on FDS right through here and aiming towards the radius. So maybe slightly angled like that and staying away from this neurovascular structure because FDS is a little bit deeper. You don't necessarily have to hit bone, but you do need to come deeper than you did for the FCR. Palmaris longus, we're not going to needle. You could, but not everybody has it. It's superficial. It's a small muscle. The other two flexors that I want to talk about are going to be the flexor carpi ulnaris. And as you can see, we're going to needle flexor carpi ulnaris on the ulnar side, and we're going to aim in this trajectory towards the ulnar side. FDP, we're also going to aim towards ulnar side, and we're going to be deep, a little bit deeper. So towards the ulna or towards the ulnar side. So you could needle directly towards the ulna with the FDP, knowing that it's a deeper muscle. So that's going to be our dry needling techniques for the flexor compartment of the forearm. So Pronator teres, flexor carpi radialis, and flexor digitorum superficialis, all aiming or emanating on this radial side. Again, like we talked about Pronator teres, you have a couple options based on where you are, proximal or distal, and then flexor carpi ulnaris and flexor digitorum profundus more on the ulnar side as they travel more in that area.